$1 billion can save 1 million lives, but we're choosing not to. You know that parable of the child drowning in a pond where there's a kid dying every 6 seconds? If they were here, we'd save them, but they're on the other side of the world, so we ignore them and just continue watching YouTube. You know, Louis Pasteur once said, "It is within the power of man to eradicate infection from the earth. And because we have the power, it's our responsibility." And so today, we're gonna pretend we have that $1 billion, and we're gonna look at 4 things. 1, how it compares to overall aid budgets. 2, we're gonna look at these infectious diseases and how we can remove them from the earth. 3, we're gonna look at these non-communicable diseases like cancers and heart diseases and what we can do about them. And finally, number 4, we're gonna end with a special way to 10x our impact. Let's do it. Okay, so you wake up today and this genie has gifted you $1 billion, but he's this weird do-gooder genie and he says, hey, you have to give this $1 billion to other people. So I'm more just like giving you this like task to do. But you say, okay, I'll do it. And so the question is, what should we do with that $1 billion? We're trying to save as many lives as possible. And what should we do? And so we can start with this chart to say, okay, we're trying to save lives. How many people are dying today? And this thing shows you that there's roughly 55 million people who are dying today. A lot of them die of these non-communicable diseases like heart disease and cancer. We die of infectious diseases still, like pneumonia and HIV. And then there's some of these other ones like, maternal and neonatal deaths and transport accidents and stuff. And so the puzzle is, can we take that $1 billion and save 1 million lives? And I think the answer is yes, which is kind of interesting. 1 million lives would be roughly 2% of this. And so how could we save 1 million lives with that $1 billion? The first question I want to ask is that $1 billion actually going to make a difference? How does it compare to global aid budgets overall? Okay, so here's a graph that shows aid budgets. DAH stands for Development Assistance for Health. And you can see here that over time, we've gone from about $10 billion spent on aid to, around $60, $80 billion. And then after COVID, after the money printer stopped, then we've gone down a lot, especially as the US government has cut federal funding for USAID. So I kind of think of this as about $50 billion per year spent on aid from these governments. So these are governments like United States is here, and then you have stuff like even private philanthropy, but also the Gates Foundation essentially counts as a whole state in and of itself. Gates gives tons of money away. And so our $1 billion would be about 2% of the whole aid budget for the year. You can also view that graph based off of what the money is spent on. And so this shows that, we spent a lot of money, obviously, on these other infectious diseases like COVID during COVID times. And now we spend a lot on HIV AIDS, and we spend a good amount on newborn health. And we don't spend that much money on tuberculosis or malaria or things like that. And interestingly, almost none of this graph are those non-communicable diseases, even though they take up 70% of all deaths. But an African government like Nigeria doesn't only have money from aid, they also spend their own money on healthcare. And that's what this graph shows, is you can see these low-income countries like Nigeria or Democratic Republic of Congo, they spend, you can see external aid is about 1/3 of all spending that they spend, versus this is out-of-pocket expenses, that's like normal people spending money, and then here's domestic public spending. So you can see here that external aid is about 1/3 of all spending for one of these low-income countries. So of that $50 billion of aid, that's out of a total of about $150 billion that's spent on healthcare in these low-income countries. And 2 other interesting parts about this graph. One of them is that the more money you spend, these lower-income countries, upper-middle-income countries, high-income countries, once you're a high-income country, almost none of your spending comes from aid, obviously. But also, interestingly, out-of-pocket expenses are only 20% of spending in high-income countries, versus if you're a low-income country, your government doesn't really help you. It's mostly just your own money plus money from aid. The other crazy thing about this graph is high-income countries spend about $5,000 per capita on healthcare, while low-income countries, you can see the graph here, spend about $50. And so there's 100x more money being spent for someone like me to keep my organs good. I got my teeth fixed, I got my thumb fixed, versus it's 100x less money if you're a poor person in Kenya or whatever. Okay, so we know that the $1 billion is about 2% of the $50 billion aid budget per year, which again has gone down a bunch since the contraction overall, but especially since USAID budgets have been slashed. And that this $50 billion is about 1/3 of health spending for a low-income country. So that $1 billion, although it's only 1%, it can totally move the needle. Okay, so now the question is, what should we spend it on? And I'm gonna start with this red one over here, infectious diseases. These suck. These are mostly hitting low-income countries. For most of human history, we were all killed by these infectious diseases. It's totally sucked. And now, especially if you're trying to help young kids not die, which totally sucks. These are mostly diseases of old people, heart disease, cancer, Alzheimer's. That's how my mom died. But it's like, no, these infectious diseases, stuff like malaria and pneumonia and HIV/AIDS, those are killing, and diarrheal diseases, those are killing like 5-year-olds. We should not have that in our modern society. So yeah, let's take about half our money and pour it onto these infectious diseases. What can we do? So here's the overall vision. And I'm taking this from the Gates Foundation, where Bill Gates just said, hey, I'm going to give my $200 billion of net worth, and I'm going to give it all in the next 20 years, which is really amazing. And so he has these 3 principles, but I want to highlight 2 of them here. One of them says, no mom, child, or baby dies of a preventable cause. I agree with that. That should not be happening anymore. The other one is the next generation grows up in a world without deadly infectious diseases. That would be amazing too. We've already done a good job at eradicating some diseases. So we've already eradicated smallpox and rinderpest. And then here's polio. We've almost eradicated polio, which is amazing. Look at this, 1988, it was endemic in all these places. But now in 2019, there's only wild type polio in Afghanistan and Pakistan. And so last year, there were only like a dozen cases of polio in these places. And so by 2030, we're gonna eliminate polio from the world, which is amazing. So which of these diseases is it possible to eradicate? Well, I wanna cover all of them today. So let's start by talking about malaria, which I think it might be actually possible to eradicate. Here's a graph that shows malaria over time. And you can see in 1900, obviously malaria was everywhere. And then over time, we start to eradicate it from more and more places. And now 2020, 2025, it's mostly just in, the jungles of Africa. And so hopefully there's this End Malaria initiative by 2040, it might be possible to totally eliminate it. But how? Malaria is pretty tricky. So one of the tricky parts about malaria, it is a parasite that lives in mosquitoes. And so you can see there's these 2 parts of the cycle where in a mosquito host, it's over here, it reproduces, it exists inside a mosquito, and then those little sporozoites, those go into the human, and then those travel into our liver, into our blood, and then infect our red blood cells, which then explode. And then eventually the mosquito comes back to us and sucks our blood again, and then the process continues. Here's a different way to see that cycle, but it's actually really hilarious what it says here. This is the Wikipedia page for the malaria parasite, and I just want to read from it for a second. And I just find the words funny. So it says, the human infective stage are sporozoites from the salivary gland of the mosquito. These sporozoites grow and multiply in the liver to become merozoites. These merozoites invade the erythrocytes to form trophozoites, schizoites, and gametocytes, during which the symptoms of malaria are produced. In the mosquito, the gametocytes undergo sexual reproduction into a zygote, I know that one, which turns into eukaryote. The eukaryote forms oocytes from which sporozoites are formed. And now we're back to the start where the sporozoites are here again. When I was researching this, I just remember reading this the first time being like, oh my God, biology is crazy. It's totally a foreign language. But blah, blah, blah. All that means is that, yeah, it exists in the mosquito host. These sporozoites go into the human, and then they get into our red blood cells, and then they go back into a mosquito, and the process continues. And so there are a lot of different ways that we can try to stop this process. A big way that we've done thus far is to put bed nets over our houses while we sleep, or over our little beds while we sleep. You can spray your home with stuff to keep the mosquitoes out as well. But we're also doing some kind of cool new age things to stop malaria. And I actually want to start with these gene drives. Gene drives are crazy. The way they work is that in normal genetic modification, you change a mosquito gene, and then each offspring has a 50% chance of inheriting it. And so yeah, you get, your little weirdo mosquito here, and then over time it becomes less of the population. This is kind of like how, blue eyes, neither of my parents had blue eyes, but I have blue eyes. But with a gene drive inserted into one chromosome copies itself onto the other. So you have this one chromosome, it cuts and then copies itself into the other with something like CRISPR. And what happens then is nearly 100% of offspring inherit the modified gene. So by the end, you have 100% of the population have this gene. And so part of the idea here is you can make these like daughterless mosquitoes. So one thing you can do is you can have the sperm, instead of having an X and a Y, you can just remove the Y so it's only XX, And so you only get dudes in a population. And that's essentially what, China has done with their one child policy where they have, 50 million extra dudes. You can do that in a mosquito population with something like a gene drive. And biologists are kind of worried about this because if you insert this into the wild, then you can just destroy all the mosquitoes in a population. And is that good? Well, the interesting thing is that we're already doing things that are similar to it. So the first thing that I want to show you is something we're doing to stop dengue fever. So here's dengue fever. For an American like me, this sounds just like some random tropical disease, which it kind of is, but it still kills lots of people, 25,000 people per year. And with climate change, this is expected to increase because of all the heat. And this also spreads from infected mosquitoes. And with dengue fever, we're already changing mosquito populations in a slightly different way though. What we're doing is we're inserting this little thing called Wolbachia into the mosquitoes. And Wolbachia is one of the coolest, craziest little organisms in the world. It's a little bacteria that lives inside of mosquitoes. And in fact, it lives inside of 50% of insects. 50% of insect species have this Wolbachia bacteria. But in some of these places with all this dengue fever, the mosquitoes don't have Wolbachia, then they can infect us, and that's bad. But if these mosquitoes do have Wolbachia, then they don't really transmit dengue fever to us. And so what we've done is we've inserted Wolbachia into these mosquitoes, and then Wolbachia has its own way of essentially doing a gene drive on the population, where over time, the women can't reproduce if they don't have Wolbachia, and so the whole population becomes these Wolbachia mosquitoes. And then at the end, then you can't get dengue fever from them. And so we're already doing this around the world where we release hundreds of millions of Wolbachia mosquitoes into the wild. Here's a map that shows this. I know the words are kind of hard to see, but they mostly say that in the past decade or so, we've started to release Wolbachia mosquitoes into all these different places, and dengue prevalence has gone down roughly 100% in all of these places. And these mosquitoes come from mosquito factories. So this is one of these mosquito factories, and there's all these little mosquitoes in there, and these factories will produce something like 100 million mosquitoes a year. I forget the exact number, but we're totally mass producing them. And this is really crazy. We're already doing this like insect bioengineering in the world where we're changing the biosphere to have these new mosquitoes that can't give us dengue fever, and we're doing it by mass producing billions of mosquitoes. So all of those Wolbachia mosquitoes exist now, and this gene drives though, these experiments are likely to start to happen by the end of this decade, the 2020s. And we're gonna start not with these population suppression ones where you have daughterless mosquitoes, and we're gonna start with ones where you just change a gene to make it less susceptible to malaria. So instead of removing the whole population, we'll instead be doing something more like the Wolbachia, where we're just changing the population dynamics. The other cool piece of this puzzle that we're doing with malaria is vaccines. And so we've wanted a malaria vaccine for so long, but it's hard to know in that complicated cycle where to do it. But as you can see here, we just started putting vaccines into the wild. We just started the last year or two with these vaccines after phase 1, phase 2, phase 3 trials. Now countries in Africa are just mass producing these vaccines, and kids are getting malaria vaccines, which is awesome. And soon we're gonna get to 10 million and 30 million vaccines per year, which means that the number of unvaccinated children is gonna go to 0 by like 2035. I wanna nerd out for a second about how these vaccines work, because it's just really cool. So this is a different way to view that earlier life cycle of malaria. And you can see here that, some of these vaccines, these first ones that we have, they're called RTS or R21. What they do is as these little sporozoites, these little wobbly, little parasite things go into our body and they go into our liver, what we do, they have this kind of outer shell, kind of like a normal virus does. And what these vaccines do is they essentially pretend to be a little sporozoite. And so they make it so that our body is used to them initially, so that it says, hey, this is something that might be coming, so that when eventually they actually do come, our body is more prepared to stop them. The other crazy thing that we're doing, this new vaccine, PFS-PZITV, instead of kind of pretending to just have the protein outer layer like some of these other ones do, it pretends to be the whole organism almost. So that's the crazy part about malaria. It is an actual little protozoa, this little eukaryotic organism, and then it changes over time, kind of like a butterfly does in these different cell types. And at this time, one of its cell types is this little squiggly sporozoid thing. What this vaccine does is it actually pumps those into our body. It pumps a kind of attenuated, irradiated form, so it doesn't hurt us as much. But I think that's just a cool other way to stop malaria transmission. So yeah, coming back to this, with things like vaccines, with things like gene drives, we're actually going to be able to get close to eradicating malaria. And you can see that with something like GiveWell, which is a global health charity that looks at the effectiveness of global health charities and then pours money on things that are the most effective. And you can see that 68% of their money goes towards malaria prevention. This is their funding in 2024. And you can see, they donated $150 million to the Against Malaria Foundation, which does, these bed nets. They did another, 86, almost $90 million towards this malaria consortium, which does seasonal malaria chemo prevention, this kind of drug that helps kids not die from malaria. And they're also pumping $17 million towards these new malaria vaccines. Here's a list of their top 4 charities. And you can see this medicine to prevent malaria and these nets to prevent malaria. Those are 2 of their top recommendations. And these ones only cost about $5,000 per life saved, which is a really great deal. Okay, so we're probably pouring some money on malaria to get rid of that. The next one I want to talk about is diarrheal diseases. These kill way too many kids, but again, I think we can remove them by like 2040 or 2050. Here's a graph of diarrheal disease deaths by age around the world. And you can see in 1980, here's all these under 5 kids who used to die of diarrhea. And now it's like 500,000. So we've decreased it by more than 4x in the last 40 years. It's not good that 70-year-olds are dying from it, but it's amazing that we can get this number to 0 maybe in the next 20 years, this under 5 number. This is a graph of which pathogens kill most of those under 5 kids, that 500,000 kids per year. And you can see here that this rotavirus kills tons of them, 35%. And then also Shigella, this other little bacteria, kills about 10%. And the cool thing is that we have some antibiotics that are killing the Shigella, but then rotavirus, we just got a vaccine for it, which is amazing. So you can see here's the share of 1-year-olds vaccinated against rotavirus. At the beginning in 2000, almost no one was. And then the kids in America got it. 80% of kids are vaccinated against it. And now even in, Africa and Southeast Asia, we're getting close to 80% of kids vaccinated against the main killer of kids with diarrheal disease. So malaria, hopefully gone by 2040. These diarrheal diseases, hopefully no kids die of them by 2040 as well. And I was just highlighting there some of the cool new vaccines against these. But again, lots of the things that stop these things are just public health measures. For malaria, it's bed nets. And for diarrheal diseases, it's washing your hands and good sanitation and stuff like that. Okay, now let's talk about HIV/AIDS and this really cool new drug to stop it. So AIDS is interesting. It's like the most recent of these infectious diseases. In the 90s, it was so brutal. I live in San Francisco. It was obviously brutal here, but also in sub-Saharan Africa, it was so bad. So this is a graph of the share of deaths caused by HIV/AIDS, especially in, Southern African countries. And you can see here, it got up to like 30 to 50% of all deaths were from AIDS. We should be able to drop this from 10% to the 1% here for the world. You can see here's the share of population living with HIV. In Southern Africa, it's like 20-25% of the people there are living with HIV. I remember when I was in Kenya meeting some of these poor folks who had HIV/AIDS and then their kids had it, and it was just made them weak, and it made them weak to other diseases, and they were blaming themselves, and it's a whole sexual thing, and it's brutal. And the way I think about this around the world, by the way, is Southern Africa has problems with HIV/AIDS, while kind of central sub-Saharan Africa, Democratic Republic of Congo and things like that, they're in the jungle, they have issues with malaria. One of the main reasons why people don't die these days is because more and more people are living with HIV, but we have stuff like PrEP and things like these antiretroviral therapies, which make it so that even though you have it, it doesn't kill you. And it's harder for you to pass it on to others. So I want to talk about this cool new HIV drug that just got a standing ovation at a recent conference, and it's called lenacapavir. And let's just nerd out about it for a second. What HIV does is it has this little capsid. It gets into a white blood cell like this, and then it gets into the nucleus of that white blood cell. And then once it's in the nucleus, it has RNA, and usually in a cell you go from DNA to RNA and then print copies of that RNA. But what it does is it takes its DNA, it does reverse transcriptase, where it takes the RNA, turns that into DNA, so it goes backwards, then inserts that DNA into our cells, and then it allows our cells to just do the normal process of producing proteins from DNA. But now that DNA is kind of messed up DNA because it has HIV in it. So with our cells producing this new infected DNA, it then reproduces copies of itself, and then those copies, it gets reassembled again and then goes outside the cell and then infects other cells. And so what lenacapavir does, here's a little 2D structure, and here's the little yellow piece, it makes it so that when you're trying to get inside the cell, it kind of inhibits that nuclear import, where because it adds these little yellow pieces to it, those little yellow pieces, as you're trying to stick inside the nucleus, it's like it's too big or whatever. And then once you're even inside, it inhibits the capsid disassembly. And so it sticks the capsid too much together, kind of glues it together. And so when it tries to break up to, do its RNA thing, it's like, oh, it's hard for me to break up. Finally get out of the cell and start to try to reassemble. It's too hard for it to reassemble because it's trying to make its little pattern, but it has these annoying little yellow pieces in its Lego block that stop it from reassembling. So lenacapavir is this awesome new drug, and hopefully it'll help us get from 10% of deaths in Southern Africa to something more like 1% of deaths. So I'm not sure we're gonna eradicate HIV/AIDS, but we can do some good work against it. What about something like tuberculosis though? We've had it for so long and we've eliminated it from the West, so why is it even still on this graph anymore? Well, part of the reason why it's still on that graph is because it doesn't kill really young kids. Tuberculosis is bad, it's really bad, but it mostly kills older people. And because it mostly kills older people, it means that there's less resources put towards it, which I think is actually okay. It's good that we've decreased it some, and we should still try to decrease it, but it is a little bit more a disease of old age. Still, it's totally a political choice that we've let tuberculosis exist still. This is a great quote from a video by John Green, who has an amazing new book about this called Everything is Tuberculosis. And he has this great new video on Crash Course, which is this hour-long deep dive into tuberculosis. And one of the quotes in that video, he's like, hey, this is a great quote from Dr. Peter Mugheni, who says, where are the drugs? The drugs are where the disease is not. And where is the disease? The disease is where the drugs are not. Which is totally true. All the TB drugs are super expensive and they just exist in the West, while the people who actually have tuberculosis in sub-Saharan Africa that are dying from it, they don't get these drugs. And tuberculosis is a tricky disease. So you get these little bacteria in our lungs. Our body tries to kill them by putting macrophages, kind of these white blood cells on them, and the macrophages surround the bacteria. They might kill them, but they're not actually that good at killing them because the bacteria has such thick cell walls. And so the bacteria just kind of surround it, and it creates these tubercles, are these like aggregations of the disease, but also our immune cells that are trying to kill them. And so that's why tuberculosis can last for so long. It's in like 25% of people. It's mostly latent, but it can just exist for a long time and then later create huge issues. One of the coolest things though is that tuberculosis was one of the first vaccines in 1921, about 100 years ago, and we have this new vaccine for it that's being developed now, which is really amazing. Plus, some drug providers like Gilead and others are allowing some of these drugs that are good against tuberculosis. They're giving them at no cost to really tackle this drug-resistant tuberculosis in sub-Saharan Africa. So I'm optimistic. Okay, but we've kind of left the biggest for last here. What the heck is this pneumonia thing? Again, do people still die of that? Yes, lots of people die of it. Here are causes of death in children under 5 around the world, and a lot of them are these neonatal deaths where you're dying, before 28 days. But then after that, pneumonia is the biggest cause of death. And we can see our other friends here. Here's malaria, and here's diarrheal diseases. One of the frustrating things about pneumonia deaths is that we actually have some pretty good vaccines against them. They're just not being used. And so here's a graph that shows this pneumonia vaccine versus this normal kind of tetanus vaccine and what the coverage looks like. And so you can see that overall, countries are pretty good at doing both. Here's the line of best fit. But then a place like Nigeria, they have, 70% of their kids are immunized against tetanus and this DTP vaccine, but only 30% of them are immunized against pneumonia. And so you can see there's a big arbitrage opportunity here to push this Nigerian number up to more like 70%. And in fact, that's what one of the top GiveWell recommended charities does. These cash incentives for routine childhood vaccines from this new incentives organization, that's their whole deal, is getting people in Nigeria to get the pneumonia vaccine in addition to other vaccines. And so they pay families and moms to get their kids vaccines, which is great. Okay, so we've looked at these infectious diseases. We've shown how, maybe by 2040, we can get rid of malaria and diarrheal diseases, and then we can put a big dent in HIV/AIDS, tuberculosis, and pneumonia, partially through vaccines and partially through public health measures. And we also looked at specifically where the marginal dollar might go. So if you had that $1 billion and you're spending half of it on this, you probably want to spend $500 million mostly on malaria, because you can see here, this is the amount of disability adjusted life years that is caused by stuff like diarrhea and malaria, but then the amount of funding for things like HIV/AIDS is so much more. And so if you pour money on stuff like malaria, that might be more impactful. And some of this is short-term bed nets today, and then some of this are these longer-term malaria vaccines for the future. So that's the first part of this puzzle, is saving lots of child lives by stopping some of these infectious diseases. But the second big piece of this puzzle is like, wait a second, what about all these people who are dying over here? Don't we care about them? And the interesting part about this too is that these non-communicable diseases, heart disease and cancers, these started in the West, but now as everybody's becoming developed and as everybody's getting money and food, people are dying less of malnutrition and more of bad food and bad cancers and things like that. So what do you think? If we have $500 million to spend here, where should we spend it? And I think this is especially interesting because traditionally global health has been focused on these things, and only recently it's starting to be focused on these NCDs, these non-communicable diseases. So it's pretty interesting. One of the easiest ways to say, what should we do, is by going through this list. Where you say, okay, high blood pressure kills 10 million people a year. Can we stop that? We're going to talk about that in a second. Air pollution and outdoor particulate matter, we're not going to talk about those, but they're important. Stuff like smoking though, let's chat about smoking. High blood sugar, okay, sugary stuff, bad. And then things like obesity or diets high in sodium, let's talk about that. So some great ways to have an impact are less smoking, better food, and also better blood pressure medication. Okay, let's start with smoking. As a reminder, smoking sucks. Here's the US and how we used to smoke 10 cigarettes a day, and then everybody got lung cancer, and now we smoke less, and so we're having less lung cancer. This is happening around the world though, so how do we stop that? So here's the share of adults who still smoke today. And as you can see here, America's gotten better, not perfect, but Europe loves smoking. And then Asia also loves smoking. Southeast Asia loves smoking. These places are above, roughly a third of people smoke in Eurasia. That's not good. So obviously that causes deaths. I mean, look at China here. There's like 20% of deaths are caused by smoking in China. If you've ever been in China, I lived there for 8 months. I felt this firsthand. I mean, I was every day when I'd go out to eat with people, everybody's like, smoke, choyin. And I was like, bro, I don't. Most I'd say, okay, I'll smoke. And then the couple times where I was like, I don't want to smoke, people were like, you must smoke. I was like, oh my God, I'm sorry. But yeah, smoking in China, bad. You can see here that we're making some progress on this. Here's share of adults who smoked in 2000 versus 2022. And so here's in 2000, places like Nepal, India, Norway, they used to smoke a ton. 50% of people used to smoke. And now those numbers are down to like 25%, 20%. So there's a lot of progress here. There's only a little bit of progress in places like Eastern Europe, like Bulgaria and Serbia, where it used to be 50%, now it's still 40% of people smoke. Here's France, obviously, has made roughly no change. Third of people smoke in France. If you're below the line though, that's a huge issue. In Egypt, only 20% of people used to smoke, and now 25% of people smoke. This might happen in sub-Saharan Africa as a whole, by the way, where right now it's a little bit expensive to smoke in Africa because incomes are so low, and as they get richer, there's probably gonna be a lot more smoking. Okay, so what can we do about it? What can we get all these people to move, over to the left side of this graph to say, no, it's only 10% of people who smoke in these countries. And the crazy part about this is when you think about dollars per life saved, some estimates here are even more impactful than some of those infectious diseases. So it's like $5,000 for a life there, but for some of these things, changing smoking laws, you can get like 2x cheaper, like $2,500 a life. And it's pretty simple things. The World Health Organization has this funny thing called Empower. M and then power, where you monitor the policies, you protect people from secondhand smoke, like not smoking in restaurants or airplanes. You offer people to quit tobacco use. You say, hey, if you want to stop smoking, we got you. You warn people about the dangers, so you put like the disgusting lungs on the front packages. You enforce bans on like tobacco advertising and stuff. It's like, why are you trying to get the kids to smoke vapes and then get them onto smoking later? Why do you have the cool camel who's smoking and be like, hey kids, smoke cigarettes, it's super cool. And then also you just financially disincentivize and you raise taxes on tobacco. And so here's a thing taken from Empower's recent report on what percentage of countries do each of these things. And so you can see here from monitoring of all the countries, of the 200 or so countries, 64 of them have no policy for this, 47 and then 67 have really good data around their policies and things. You can also see things like for pack warnings, people are, half of countries have good pack warnings on them. Some countries have good programs for getting people to stop. There aren't that many countries that have bans on mass media. Mostly countries just allow us to advertise smoking, which is meh. Yeah, I do think in the future that we're gonna have more frictions around these things and that this graph will look more blue so that we save lives And instead of 10 million people dying every year from smoking, it'll be more like 1 million people dying every year. And we'll see that as a commerciogenic disease of our past instead of our present. And I just want to highlight something really cool that the world did around tobacco control. You can see this is the WHO Framework Convention on Tobacco Control, which was done in 2005. And you can see this Framework Convention for Tobacco Control, the FCTC, represents a watershed moment for international public health. Why? Because it marks one of the first multilateral binding agreements regarding a chronic non-communicable disease. So yeah, the world has been pretty good at removing these infectious diseases over the past century or so, especially the past 50 years or 20 years. And now, as these NCDs kill more and more people, we're starting to say, hey, we don't want these anymore. Okay, so that's smoking. Maybe we can save from 6 million lives to, 1 million lives there. So that's smoking. Now let's talk about food. There's kind of two pieces to food. We have diets that are low in fruits and whole grains and vegetables, but also food is bad where we have diets that are high in blood sugar, we get obesity, we get high cholesterol, and we get diets high in sodium. So let's look at each piece of this puzzle, some of the trans fats, and then some of the sodium, and then some of the sugar. Okay, let's start with trans fats. Trans fats are bad. They're these little bits of fat, like margarine or shortening. They stick in our bodies and we don't have enzymes to break them up, and so it allows the fats to stick around, which clogs our arteries, and then kills us through heart disease. And so they're often things like French fries used to be a huge source of trans fats for Americans, obviously. But now we don't use trans fat in the oil for French fries. Hooray! You can see here's a graph of trans fat intake as a percentage of all energy for adults. And so you can see here's America. So this was in 2010, but we've actually made a ton of progress on this. And so in 2003, the FDA said, oh, it's bad. And then in 2000 and maybe late 2000s, early 2010s, that's when McDonald's and all the fast food people banned it from use in their French fries and other things. Walmart banned it in all their foods in 2016 maybe. And then in 2018, the FDA said, hey, this is generally unsafe for use. And so now it's removed in most foods in America, which is amazing. And so it's gonna save hundreds of thousands of lives and also save us, I believe the data said something like, hundreds of billions of dollars on our healthcare system. And so America's done an okay job recently of this, but look at these other countries over here. Egypt and Pakistan, they have way too many trans fats. And this is in things like ghee, like their butter or whatever. Here's another way to visualize that graph. You can see there's a 28-fold difference in trans fat consumption around the world. And here's countries like France or whatever that, although their food's pretty good, they don't have much trans fats. And then you have countries like the Americas that have too high, but especially Pakistan and Egypt, very, very high. But the amazing thing is we're pushing back against this. And so here's a graph that shows countries that are starting to push back and ban these trans fats. And so you can see here at the beginning, it was just Denmark and Chile and South Africa, New York and California. And then finally, here's the US, 2015, we started to push back. And then boom, this thing called Replace launched, where he said, hey people, let's actually replace trans fat in food. And now, as you can see here, here's Egypt in 2022, they got on the list. And here's Pakistan in 2025, that's this year, they're on the list. And so now like a third of all countries have these best practice policies to stop trans fats. And especially it's important that Egypt and Pakistan are on this list because that's where so many of the deaths come from. But what about sodium? Sodium's killing us too? Why do all the delicious things kill us? Well, sodium, the big issue is that if you have too much sodium, it makes your blood bigger because the sodium's in the blood and then it kind of pushes against your walls. And so that makes you have higher blood pressure, more hypertension. And so here's a graph that shows cardiovascular deaths that are from sodium consumption. And so, yeah, you can see here in Central Asia, in China, Mongolia, almost like 15% of cardiovascular deaths come from sodium. And overall, you can see it's like, roughly 10% of cardiovascular deaths come from too much sodium. Where is that sodium? Well, in the US at least, it's often in bread. So you can see here sandwiches, Sandies. Ain't nothing wrong with a little Sandy. But yeah, sandwiches have 21% of the excess sodium. Rice has a lot of it, chips, pizza, etc. So a lot of these kind of bread-based objects, they just have lots of sodium in them, but it doesn't actually change the taste. And so what people are trying to do is they're trying to do reformulation where they get companies to just have half of the amount of salt in their bread. Still tastes good, it's still bread, but then you die less from it. So a bunch of countries now have laws around the salt content in bread. And so you can see this is a thing called charity entrepreneurship, which funds new people to create new charities in the world. And last year they just said, hey, one of the recommended things we're gonna do is do advocacy for salt intake reduction. And so again, this is kind of a cool way to see how effective altruist people, traditionally they've been focused on infectious diseases, but they're starting to skate to where the puck is headed and say, okay, no man, salt's got to get out of here too. The other one that we're pushing against is sugar. So this is the number of countries with a sugary beverage tax. And so you can see, just like with the trans fat graph, where it's like, yeah, in the 2000s, most countries had nothing, but now like 50 or 60 countries have a sugary beverage tax. That's good. Sugary beverages are bad for you. And then finally, on blood pressure control, you can see that right now only 21% of people have good blood pressure control. If we get that up to 50%, that'll obviously save millions of lives. And so here's this list of things from this great organization called Resolve to Save Lives. And yeah, you're supposed to have these standardized protocols, these right digital platforms, the right, medicines and technology. And so they're essentially helping health systems get better at treating high blood pressure. And the interesting piece about non-communicable diseases is that they're pretty underfunded. And so you can see here's this Resolve to Save Lives, which is that organization that focuses on these things. So they focus on salt reduction, they focus on trans fat reduction, they focus on blood pressure control. They just started and they spend about $50 million a year on this, which compared to something like malaria, there's, hundreds of millions of dollars going to malaria, but less money going towards these non-communicable diseases. So I think it makes sense to pour some money on things that stop high blood pressure and smoking, high blood sugar, obesity, cholesterol, these high sodium diets. The world is just starting to stop all these things, but it's a great place to put money now to make sure that we accelerate that transition. So yeah, if it was me, I'd put, maybe half my money, I'd pour it onto these infectious diseases and try to stop lots of deaths here, especially around malaria, start to eradicate some of these things and to stop the kids that are dying from all these things. And then I'd also pour some money on these non-communicable diseases. These have been shown to maybe have 2x more lives per dollar saved. And so we can really pour money to stop some heart diseases and to stop some cancers, essentially putting taxes and other things around these companies and these commerciogenic diseases like smoking and bad food. I want to highlight 2 other places you could put money if you're thinking about skating to where the puck is headed. So one of them is antimicrobial resistant infections. These are when the little microbes are killing them with all these other things, all that other money we spent to kill little microbes. The issue is that they become resistant. And people think that maybe by 2050, we're going to roughly 10x the amount of deaths that come from AMR, and it'll be up to like 10 million, which is the same amount as cancer. So there are a lot of interesting good places, both within the pharma industry and other places that are trying to stop this coming wave of AMR deaths. The other piece of the puzzle, obviously, is large pandemics. We've had the Black Death, and then we had the Columbian Exchange, and then we had the Spanish flu in 1918, and then we had the HIV/AIDS epidemic, which we're still dealing with, the 30 million deaths from COVID. And so there's a lot of also good money you could put towards pandemic and epidemic prevention, and especially some of these like bioengineered pathogens that might come with AI. So I might put like half on infectious diseases and half on non-communicable diseases. But now I want to talk about the fourth thing, which is, can we 10x our money? Can we put it? This would be like putting it in the lottery or putting it in the stock market and then pulling it out. And then now we have 10x more money to put onto other things. And when you actually think about saving more lives, some of those infectious diseases, it's like $5,000 a life, or the non-communicable diseases, it might be like $2,500 a life. But if we're trying to get to $1 billion for 1 million lives, that would need us to get lower to like $1,000 a life. And so how can we take our money and make it so that there's more money? And the way that we can do that is by taking our money and encouraging other rich people to donate. So here's what I mean by that. Here's a great graph from our homie Bill Gates, who just announced earlier this year that he's going to give away all his money before he dies. He says, look, my net worth will drop 99% over the next 20 years. So you can see his net worth has gone up to $100 billion. Whether you think that should happen or not, who knows? But he's definitely been super helpful for the world. And now he's already done a great job of stopping these infectious diseases. In the next 20 years, he's planning to just pump money into the system. He's going to spend about $200 billion all going towards, child health and maternal health and schools and things like that. So this is awesome. What this shows is that as a billionaire, it's actually possible to give your money away. Andrew Carnegie said, the man who dies rich is thus disgraced. You don't want to die rich. When Bill Gates dies, he's like, hey, the main thing I want people to think about me is not he died rich. Instead, you want to say, no, he gave his wealth away. And so Bill Gates is going to spend, $200 billion over the next 20 years, which is amazing. But he's just part of the 1%, right? And so you can see here's the wealth of the top 1% in the US. It's around 40 or 50 trillion dollars. So Bill Gates is giving away his, $100 billion, which is great, but there's 450 times more money in the system here. And so it's like, yeah, we can give this money away too. And people are like often like, oh, what do you mean you can't get the rich people to give their money away? It's like, no, Bill Gates is showing that you can totally do it. And so I'm imagining you can take, $100 million of the $1 billion and you say, hey, how can we access this massive amount of wealth and how can we direct that to good things? That's how you 10x your money. And so you can look at this by saying, how much do the rich currently donate? And so this is the top 1%. I'm part of this, by the way. I make 100K running my little nonprofit in San Francisco, which is below the median income here, which is crazy. And this is now looking at income. So you can see of their, $23 trillion that they make every year, they give away, it's like 3% roughly, so a little bit less than $1 trillion. And then the top 0.1%, people who make over 500K, they make, $12 trillion a year and they give a little bit more, 4 or 5%. So they're giving away again, about $500 billion per year. There's already a system for this called the Giving Pledge, which started 15 years ago. And it was this thing that the billionaires did, Gates and Buffett, and they were like, hey billionaires, try to give away 50% of your wealth. And there was a great article recently that checked and said, how are we doing at that? Have they given away 50%? And so this shows who's given away their wealth in a good way. And you can see, folks, here's Gates. He's got $100 billion and he's given away 35%. So not bad. He's not doing bad. And this is going to be 99% within the next 20 years, which is amazing. The other person, though, the Arnold Foundation, they're amazing. They've given away 62% of their wealth to charity, which is great. Dustin Moskovitz and Carrie Tuna, this is the OpenPhil people and the GiveWell people. They have $14 billion. They've given away 33%, so they're doing a good job. And so you can start to see, here's some of these top people that are doing a great job. And then here are these, kind of the bad people over here. Larry Ellison, he's got $150 billion and he's given away nothing. For me, I find that's not good. I mean, it's cool that Larry's still working on Oracle and that he's still part of these conversations to make the OpenAI money, and that's really awesome. But it's like, damn, he's 80 years old. He's 81 years old now. A lot of people at that point have transitioned to giving away their wealth. And it's cool that Larry's still into Oracle, but I just wish that he either had someone in his family or someone else he trusted to start really giving away instead of just 1% to charity, making $80 billion go to charity. You can see here's also like the CZI folks, Zuckerberg and Chan. This is kind of cool that they've made, their wealth has increased so much from Meta stock, 4,200%, but they're still only giving away 6%. This is a little bit more okay because they're younger, but you really want to start pushing people towards this, like giving away 50% plus, or like Bill Gates, 99%. No one wants to die rich. Let's try to pump money into the system to help save lives and to help make better lives for everybody. So yeah, I'd probably take $100 million of the dollars and put them towards accessing this $45 trillion. Where even if you're able to take $100 million and turn it into $1 billion pointed at those really good charities, then you can save a lot more lives with that. Great. So as a reminder, kids are dying every 6 seconds and we can spend money to save their lives now. There are 50 million people who die every year. We can decrease that by about 1 million lives per year with $1 billion. We should place money on all these things. And by 2040, 2050, hopefully very few people will be dying of infectious diseases and no kids or moms will be dying before the age of 5. Plus, as that happens, we're going to start to fight against these non-communicable diseases, which is awesome. We don't need everybody to be dying of high fat, high sodium, high alcohol, high sugar diets, and high smoking lives. Instead, we can live better, happier, healthy lives. And we got to start to do that today. Thank you, as always, for watching. And thank you to Roots donors for supporting this channel. If you want to understand more about the past and how we got here, check out the previous videos here. And if you want to understand the future and where we're going, feel free to subscribe here. Hope to see you then. Bye.